Hi, thank you so much for joining me on this lesson in medical terminology with a focus on the endocrine system. My name is Erin White, and I'm an instructor at the Ultimate Medical Academy. So let's go ahead and get started on learning about the endocrine system. So, the endocrine system is going to be a production of hormones that work together to maintain homeostasis. And remember, homeostasis is going to be a balance in our body. So our body is always going to work its hardest to either cool us down or warm us up, or just make sure that all of our body is balanced. So the endocrine system is going to help with this. So the hormones are going to be chemical messengers that are secreted by endocrine glands that directly go into our bloodstream and reach the target of cells and organs. They also regulate activities of specific cells and organs. So the structure of our endocrine system is going to be adrenal glands, gonads, the male testes, the female ovaries, pancreatic islets, parathyroid glands, pineal gland, pituitary gland, thymus, and the thyroid gland. So let's go ahead and get started in learning more about all of these different structures of the endocrine system. So here's a diagram of the endocrine system and all the parts of it. So we'll start off with our glands. The endocrine glands are going to produce hormones, and they are ductless. So endo is within, and crine is to secrete. So it's going to secrete. There are 13 major glands in the endocrine system: pituitary gland, a pineal gland, a thyroid gland, 4 parathyroid glands, 1 thymus, 1 pancreas, 1 adrenal gland, and 2 gonads. So let's start first with the pituitary gland. The pituitary gland is located between the hypothalamus in the brain. So as you can see in the diaphragm, you can see where the hypothalamus is in the brain, and then the pituitary gland is located right below that. It has 2 divisions. It has an anterior and a posterior lobe. It secretes hormones that control the activity of all the other endocrine glands. And this hormone is called ADH, or antidiuretic hormone. This is secreted by the hypothalamus and stored in the pituitary gland. So the hypothalamus is going to secrete the ADH hormone, and it's going to store it in the pituitary gland. This helps you by controlling blood pressure, by reducing the amount of water excreted through the kidneys. So again, your ADH hormone is going to help control blood pressure because it's reducing the amount of water which is excreted through the kidneys. It also responds to stimuli from neurohormones to maintain appropriate levels of hormones. Let's talk about the pineal gland. As you can see in the diaphragm, all the way to the right, the pineal gland is located right there in the brain, kind of behind the hypothalamus, towards the back of the head. So it's located in the central portion of the brain, and its functions and secretions. So the secretions influence sleep, which is wakefulness cycle, also called circadian cycle. And then melatonin is the hormone responsible for this cycle. So as your body produces melatonin, it's telling you to sleep. Let's look more at the thyroid gland. So, the thyroid gland lies on either side of the larynx, which is just below the thyroid cartilage. Its functions is regulates body metabolism and influences growth and functioning of the nervous system. So, as you can see on the right, the thyroid gland is going to lie on either side of the larynx, which is right below the thyroid cartilage. And this is going to regulate our body metabolism. So, the thyroid gland has two primary hormones that regulate our metabolic rate and affect growth and rate of function of many body systems. So, a few of those are going to be thyroxine, which is also known as T4, triiodithyronine, which is T3. And then this is the rate of secretion that's controlled by your TSH produced by anterior lobe of the pituitary gland. So that was a lot to take in. But basically, your thyroid gland has two hormones, and they are regulating your metabolism and they're affecting your growth. So again, the thyroid gland is regulating your hormones by impacting your metabolism and your growth. Calcitonin is also a parathyroid hormone, which decreases the calcium levels in the blood and tissues by moving calcium into storage in bones and teeth. So your thyroid gland does a lot. And you may hear people say that they have a hypothyroid or a hyperthyroid. This just means that their thyroid is maybe a little bit slower to act or maybe it's overactive. So they may have to take medication in order to regulate their thyroid gland. The parathyroid gland are four glands that are embedded in the posterior surface of the thyroid gland, and they function to regulate the calcium levels and also secrete the parathyroid hormone, also known as PTH. So, the parathyroid hormone works with calcitonin to regulate calcium levels in the blood and tissues. So, your parathyroid is going to regulate your calcium levels in your blood and your tissues. The thymus. As you can see on the diagram on the right hand side, is your thymus is located right in the midline anterior portion of your thoracic cavity. So it's right located there underneath the shoulder blade. You can see the label for thymus gland, and it's pointing to a tiny little gland that's going to be in the midline of your body in the anterior portion of your thoracic cavity, but posterior to your sternum and superior to your heart, right there in the middle of everything. So this gland, the thymus gland, helps develop immune system before birth and in childhood. So it's going to help out your immune system. And it reduced functions after puberty as it turns into fatty tissue. So it's really helping us develop our immune system as a child and before we um, give birth or before we are born. So it's reduced function after puberty. Really, it doesn't do much after you hit puberty and it just turns into fatty tissue there. The pancreas. So, as you can see on the right hand side diagram, you can see the pancreas right there below your heart. So the pancreas functions as a part of digestive system as well as the endocrine system. So it's functioning in both systems. And then you have pancreatic islets that have an endocrine function. So this function is to control your blood glucose levels and glucose metabolism throughout the body. It's also going to secrete glucose, which is your basic form of energy used by the body. So, our glucose is also impacted by the insulin that we need in our body. So, this is where the pancreatic gland, if it's not functioning properly, may cause us to need insulin or not need insulin. So, secretions of the pancreatic islets. Let's talk more about insulin. Insulin is the hormone secreted by beta cells in response to the high levels of blood glucose. So, if you're having high levels of blood glucose, your body is going to say, you need more insulin. It's going to allow the glucose to enter the cells to be used as energy. So, instead of it just sitting there, and turning into fat, it's going to say you need more energy. And the insulin is going to push those glucose cells to be turned into energy. And then it's going to stimulate the liver to convert the glucose into glycogen. And then the liver is going to store it when additional glucose is not needed. So, this is why it could be bad if you have too much glucose in your body, because then it's going to be stored in your liver. And that can cause your liver to get fatty. So, the adrenal gland. Adrenal gland is also part of the endocrine system. And the adrenal gland is located at the top of each kidney. This is an adrenal cortex, known as an outer portion, or adrenal medulla, known as a middle portion. And this is going to control the electrolyte levels within the body. So, again, your adrenal gland is located at the top of each kidney, and then there's an outer portion and a middle portion. So, the electrolyte levels are going to be calcium, chloride, magnesium, phosphorus, sodium, and potassium, normally found in blood and other body fluids. These are going to help regulate metabolism and interaction with sympathetic nervous system in response to stress. So let's take a minute to really think about what that means. Your adrenal gland is going to control the electrolyte levels within your body. And by controlling those electrolyte levels, it's helping you regulate your metabolism and your interaction with the sympathetic nervous system. So remember, the sympathetic nervous system is when we are responding to something that's stressing us out. And your adrenal gland is going to help you regulate this. So all of our body systems really work together. Because when you're stressed, let's say you need to go somewhere quickly, or maybe somebody's chasing you and you're trying to get away, your sympathetic nervous system is going to kick in because you're stressed out. But your adrenal gland is also helping controlling those electrolyte levels and regulating your metabolism that you need to get out of that situation. Let's talk more about some of the types of diseases or disorders that could be caused by the endocrine system. So, with the pituitary gland, there's something called acromegaly. This is an abnormal enlargement of the hands or the feet due to excessive secretion of growth hormone after puberty. And remember, ACR slash O with the combining form means extremities. So large extremities. So the pituitary gland is causing maybe an excess of growth hormone once puberty hits, and then the feet and the hands get really large. Gigantism is an abnormal growth of the entire body caused by excessive secretion of the growth hormone before puberty. So, abnormal growth of the entire body. So, this may be someone who is a child who should not be as tall as they are based on their age, but because they had excessive growth hormone, they have what we call gigantism. And then you have um, hyperpituitarism. This is excess secretion of the growth hormone causing acromegaly and gigantism. So this is both. The hyperpituitarism is causing lots of excess growth hormone. So it's causing gigantism and acromegaly. And then there may be the opposite. So, short stature may be due to deficient secretion of the growth hormone. So, there's not enough growth hormone, and the child is not growing after puberty. And then pituitary ad- adenoma, which is a slow growing benign tumor of the pituitary gland. So, unfortunately, this would be a tumor of your pituitary gland that would need to be taken care of. So, more diseases about the endocrine system. Diabetes insipidus. This could be caused by insufficient production of ADH. Remember, that's the ADH hormone, or inability of the kidneys to respond appropriately to this hormone. So either you're not producing enough of the hormone or your kidneys are not responding to it. And this is causing diabetes insipidus. So there's too much fluid excreted by the kidneys. Syndrome of inappropriate antidiuretic hormone. This could be overproduction of your antidiuretic hormone, leading to water retention. So, a lot of swelling could occur with this. Hyperglycemia. Hyperglycemia would be an abnormally high concentration of glucose in the blood. So, an abnormally high concentration of glucose in the blood could be sugar. So remember, GLYC is sugar. So there's too much sugar in the blood. And the symptoms could include polydipsia, polyphagia, and polyuria. And polydipsia is excessive thirst. So dipsia, DIPSIA, means thirst. So polydipsia is going to be excessive thirst. And this is going to be caused by hyperglycemia. Some medical specialties that may help with um, some of your endocrine system diseases or disorders would be an endocrinologist. So they're specializing in diagnosing and treating diseases and malfunctions of the endocrine glands. A certified diabetes educator would be qualified to teach people with diabetes to manage their diabetes properly. So remember, the different types of um, endocrine system that you can see here on the right would be the pineal gland, the hypothalamus, pituitary gland, thyroid gland, thymus gland, pancreatic islets or the pancreas, the male testicles, the ovaries, adrenal glands, and the parathyroid glands. All of these glands are going to help with your body in regulating homeostasis and making sure that your body stays balanced. Thank you so much for listening to my lesson on medical terminology with a focus on the endocrine system.